Hello, 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 hello. Good evening. What do I say? Good morning, good afternoon, good evening. I want to welcome you to your special show, Your $1 Billion Body, with the one and only in-house doctor, Salad Master Doctor, Dr. Dolly. Hi, Dr. Dolly. Good evening. How are you today?
Yeah, good evening, Mr. Marvel. I'm very good today.
Okay, fantastic. I want to say it's a pleasure to be on the set today. Thanks to Mr. Tony Bello. He's not here today,
Oh, yeah.
and he does send his greetings. Actually, want to welcome you to the show. We actually started with some powerful information from Dr. Dolly yesterday, and today we're going to be doing the part two of the show. So please do say to your friends, your family members, and everyone who you have invited to this show that the show has started. And by the way, you can ask your questions, and we're right here to take all your questions. You can use the Q&A button up, or you can send a chat in, and we'll take all your questions for you. Now, we're streaming live on YouTube, and not to forget Salad Master. This show is proudly sponsored
By
by Salad
Salad
Master.
Master.
Thank you, Salad Master. Salad Master is that healthy cooking company that helps you eat your food the right way, ensures that 93% of the nutrients is saved. Okay, so without wasting time, I'm going to hand over to our one and only doctor, Dr. Dolly.
Oh,
Hi, Dr. Dolly,
yes,
over to you.
I'm fine.
Okay.
Hello, viewers. Thank you for tuning into this program and welcome. So, today we're going straight into childhood obesity. Like our last show, we did tackling adult obesity, and this time around it's for the childhood obesity. Now, I'll likely do a quick recap of what we did yesterday. We said that anybody who's when you go walk into any clinic or any health facility and you measure your weight against your height, weight should be in kilogram and height should be in meters, and that will help you get your BMI. And if your BMI is equal to 25 or more, that means you're overweight and you need to watch it. And now, if it's equal to 30 or more, then it means you're obese, and then that is when it gets complicated. Now, in that same clip yesterday, we talked about the risk factors, the prevention, and the treatment. So we'll employ you to go check it out. There's a whole lot of information for you to use there.
Okay.
Yes. So now, today, childhood obesity. Childhood obesity is also called pediatric obesity, and it is defined as a condition in which a child is significantly overweight for his or her age and height. There's a particular weight a child of a certain age should wear, and there's a particular weight a child of a certain height should be. So when this is not in unison or in correspondence to each other, then there's a problem. So now, and we have noticed it actually that children of this I don't know the urban areas, most of them are obese. I don't know whether their parents want to show they are well off or they can feed them right or whatever. We don't know what it is, but we have noticed the prevalence increasing, and we that's why we decided to do this program and this topic right here. Now, it is very common, this childhood obesity, and up to 1.5 million cases per year has been recorded in Nigeria.
Wow. Wow.
Yes. So it's
Wow.
really a
That's
staggering
that's a
figure.
lot. That's a lot,
Yes.
Dr. Dolly.
Yes,
Yep.
it's really
And you
staggering.
said something yesterday that actually I wrote down. I
Okay.
took note of it.
Okay.
You said something like in today's world,
Yeah.
some parents actually want to show that their children should be big,
Yes.
so they take them to some shops
Mm-hmm.
and like some food shops. Yeah, I
That's
don't want to
right.
mention any name because of the show.
Okay.
And if the child is slim, they think something is wrong with the child. So they
Yes.
have to go and buy those pizza and all of those
Uh-huh.
things. So the trend, like you said, is actually a trend
It's
in
a
today's world.
trend,
Wow.
yes. And you see that not only previously it was parents of children, parents who were not so educated, but now it baffles me to even know that parents who are well educated also encourage their children to go through this way.
Wow.
So now we want to bring to the fore the complications in which you expose your child into when you want them to be of a certain size just because society wants it, but it's not healthy for them.
Mm.
So now let's go straight to to that. Now, it is now said that childhood obesity, it is a growing global public health concern. So why is it a health concern? Because it has so much attendant problems. Now, it was formerly found in developed and affluent countries, but current trends shows that there's a gradual shift in dimension towards developing countries just like ours. So, what are the complications? Why don't we want our kids to be obese? Why do we want them to be fit and not fat? These are the complications of childhood obesity. One of them is renal disorders. When I mean renal, I mean coming zeroing in on the kidneys. Any child who is obese might likely come up with kidney malfunctions. And I know that no parents wants that for their child. You can imagine a child or a teenager who starts at that age to manifest symptoms of kidney failure. Well, how long would that child be? Just because your parents or you are a parent, you want your child to be in some type of way, or to people to see your child and your family indirectly in some type of way that, okay, fine, this child is big. Oh, they are looking like children who are living in the US. Why would you want that?
Wow.
You want a healthy child at the end of the day. So kidney disorders is one of the complications. Another one is cardiovascular disorders. Of course, of course, of course. Like what we said yesterday, any child who is being fed all the fatty foods, the pastries, the fast foods, the indomies and all, this is what is going to happen to that child is by the time the child gets to 35, these arteries are going to be so clogged by fats that the child can't even run straight for 15 minutes without stopping to pant heavily.
Wow.
Yes,
Wow.
it's that serious. Another one also is musculoskeletal disorders. Musculoskeletal just means the bone and the muscles. Now, when the bone is given so much burden, see, the difference between childhood obesity and adult obesity is that for this is a framework, a skeletal framework for an adult. All the bones are strong, they've ossified, they've stopped growing. So they can deal with a greater weight than a child whose bones are still forming, and then you burden that bones with extra fats to carry. So you can imagine those kids, invariably they have fractures, leg fractures, hand fractures, and all of that. So that is one of the complications. Another one also is the respiratory disorders. Now, this usually is where the lung is, and all these things we call the rib cage. They are there to protect the lungs. Now, when the lungs are there, they are still growing. Now there's already extra fat to contain this to contend with in this small space. You can imagine what happens to that lungs. And over time, it starts manifesting. And at the end of the day, it's still the parents that bear the brunt.
Wow.
And then putting the child in harm's way just because their parents refuse to apply the knowledge they have. Yes.
Just before you go on, Dr. Dolly, you
Right.
actually mentioned something about cardiovascular disease
Yes.
or disorders
Oh, yes.
in children.
Yes.
Wow. Usually, I mean, a lot of people in society know about adults having cardiovascular problems.
Yeah.
Yeah. But now you're mentioning even children.
Yes.
Is there a certain age? Maybe, for instance, you can measure that because I saw a stat the other day saying from age 14, even from age 14,
Yes.
children were showing these characteristics.
Yes, it's a gradual thing. It builds up over time. Like we see here, this vessel is patent. That means it's open, no obstruction. Now, fats are coming to occlude inside this vessel, and it takes from this stage to this last stage takes a while.
Wow.
So, yeah, so it can actually manifest in late adulthood or early, late teenage years or early adulthood.
Wow.
That's when it manifests.
Wow.
Yeah.
Wow.
That's it. So the next one is neurological disorders. Neurological means the brain and spinal cord. They're all still growing, they're all still developing. And when you have fat to choke them up, there's going to be a problem. And over time, it manifests. Another one is psychological disorders. Of course, kids who are known to be fat in school, they are bullied. They have low self-esteem. They don't want to socialize. They feel they're not attractive. All of that just because of the way they are fed at home. Yes. Another one also is the emotional problems that they encounter. all of them that are all fat, when you come one-on-one with them, you see that they don't want to be fat because they stand out in school. You're so obese. Other children are during the playtime. Other children are dancing around cleverly across the room and across the field, and they are just there moping in one place. You see, at the end of the day, nobody wants to be their friend,
Wow.
and the repercussion is they get depressed. And with that spirals a whole lot of problem that, if not controlled, can just go out of hand, and that will be problem that can even manifest as psychiatric problems if care is not taken.
Okay. Now, the child obesity, like you're treating now, Dr. Dolly,
Yeah.
I know parents who go as far as buying medications for their children to grow big.
To eat.
Yeah.
Yes.
I don't know why that is, but from what you're saying now,
Yeah.
even, in those days, they have to give you some warm tablets, dewormer, so that you
Yeah.
can eat and be big, and they compare you to people. Can't you see this?
Yeah,
Can't you see
this
that?
person's son. This,
So it's parents actually have a role to play.
of course,
You know?
the greater role is on them.
Wow.
It's on them because, first of all, it starts with the food you expose your child to very early in life. And secondly, the portions they are used to getting at home. Even if they're not home, they want those kind of portions because they are too much for them. So now parents should leave their kids. Some kids are naturally sleep by nature. And if they
Okay.
are medically certified healthy, I don't see any reason for them to worry. Because I know a man who keeps bringing his child to the hospital, that we should check whether this child is an asthmatic patient. Oh no, what is it? Sickle cell patient. I was like, why? He said she's too skinny. She said, I
Wow.
said, no, this baby, we've done this test for her over and over again. She is not a sickler. Could you just let her be?
So medically, the child is okay.
The
Medically.
child is okay. It's
Yeah.
just the size that the father is worried about.
Oh, I see.
And some of them feel, if my child comes in this kind of, is very skinny, it means my wife is not taking care, or
Oh,
maybe I'm not bringing money home, and
okay.
people are seeing him in some type of way, and maybe it says he's an irresponsible father or something like
I
that.
think parents should be sensitized or trained.
That is the
Yeah.
whole point.
So not to think that when the child is skinny,
Yes,
yeah,
there's
there's
something
something
wrong,
wrong with the child.
or they're not
They're
eating
not properly
well.
fed.
No, they're properly fed.
Yeah.
The thing every parent or every caregiver should have at the back of their mind is to feed this child fit and not fat.
Wow. Fantastic. Fit and not fat.
Yes,
Wow. That's a good one.
yes.
Yeah.
The child should be fit and not fat. And when they are fit, it affects everything. Intellectually, they are sharper, and so many things.
Okay.
So the thing, we're going to see all those so many things right now. We're going to see what in our environment causes children to be obese. Now, let's look at it now. Causes in our environment that contributes to childhood obesity. Number one, I will look at is the shifts in lifestyle and behavior. Now, like we just said, there's this urge for parents to make their kids be fat, be chubby, look well fed. There's nothing that says that the fat child is healthier than the slim child. As a matter of fact, it's even in
Reverse.
reversal.
Wow.
Yes, it's in reverse.
Really?
Because the child who is fit is way healthier than the child who's fat.
Well, yeah. Yeah.
Yes,
Okay.
and the children who are fat, they just stay on it. So they are dull. Kids are not supposed to be dull. Childhood is this time that you should be able to be fit, be around, play around, explore your environment, explore nature. And but when the child is obese, they have the tendency to just stay on the spot.
Okay.
Yes, and just be there. And that's not the way it should be.
Okay.
Already, that kind of dullness should ring a bell to a parent and know that when you were at that age, you were not that dull. So what is going on? There must be something you're not doing right.
And if I understand what you just said correctly, children are supposed to be physically active. They're
Exactly.
supposed to play around and
Yes.
do all of those
They're
activities.
supposed to do it because if you don't do that, it comes back to them later in life.
Oh wow.
Yes, it does. It comes back to them later in life because let me take for example this very popular musician Michael Jackson. Everybody knows Michael
Yeah,
Jackson.
everyone knows Michael Jackson.
Yes, he had that as a child. He wasn't that he was obese, but he was not let to be a child. So all the time that other kids were playing in the parks and having picnics, he was in the music studio recording his songs.
Mm.
At the end of the day, he became an adult that was forever seeking the company of children,
Oh,
which people found to be odd.
to be weird.
Yes, to be very weird. But actually, in medicine, we know that it happens.
Okay.
Yes.
That's there's a medical
Yes,
back into that.
yes, it means that he's still trapped at that
In his
childhood
childhood age or
stage
stage.
mentally.
Oh wow.
Although he's grown and he's a man, but
Okay.
mentally he's still a child.
Wow, 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 wow.
Yeah.
Fantastic information that you're giving. Now, I think parents who are watching right now are taking notes.
I should,
And
if I were them, I will.
absolutely. Please
Because
do take notes.
what is happening now, they are laying an underground for the child to have problems in the future.
Wow.
Health problems, self-esteem problems, and a whole lot more.
Okay.
So please,
Okay.
if I were a parent, I should sit up and really take notes.
Oh, fantastic.
This is really, really important.
Okay. Great.
Another cause of childhood obesity can be medications. Yeah, there are some kind of medications that you can place a child that will make them be fat. But if the medication is stopped, the child can lose the fatness, depending on what actually is being treated for and what exactly is going on. So another one is cultural beliefs. There are some people that their culture just doesn't like very skinny children. If I know, even mine, because when we were little and we had to go home for holidays to grandma, if you are really skinny, you have to stay longer with grandma so that she fattens you up.
Like I just said.
Yes, so that she
Wow.
fattens you up. So it's also a cultural belief, also plays a key role to that. Another ones are also food habits and choices. This is for the mothers and the caregivers who care for these children directly. First of all, food habits. What kind of food habit does your child have? Do you keep from the moment they open their eyes in the morning till the night they close it again, till the time they close it again at night? Do they keep eating? Do you look out for them? Do you watch them? What are their food choices? Are they always eating Indomie? All these foods are impregnated with fattening substances so that parents will look at them and say, oh, it's good. And it will make you come by again. But at the end of the day, the long-term effect is what we're looking at in these children. There are so many kind of foods. What kind of food do they eat all the time? Some kind of children, they say, I want ice cream. If you don't give them anything, they will keep looking for ice cream until ice cream comes. So those kind of food habits and food choices should also be looked into. I know that no child was born with ice cream in their hands. So along the way, someone introduced him or her to it. So that's what we are calling now. If you've already made that mistake and they don't want to eat any other thing apart from those foods that just make them fat, what you need to do is gradually introduce healthy food. Initially, they're going to throw tantrums, but later they will accept it.
Yeah.
Yes.
And Dr. Dolly, children, I mean, most children really
Yes.
don't really like vegetables, which you've spoken of oftentimes. Is a
Exactly.
good substitute,
Yes.
for some of these snacks and all of these things that people eat.
Yes.
So I think it's also important, for parents to incorporate vegetables and fruits
Yes.
in their children's meals.
That's right.
Like you rightly said, if I mean, beginning they might not probably like it,
They will not like it.
but consistently, if you put it in their diet, they're definitely going to
like it.
go ahead with it.
Yes.
Yeah.
And then if they outrightly don't like it initially, you don't force it down their throats. There are so many ways to incorporate them into their feeds that they find it very fun to be with, fun to have. Like carrots, there's a way you can cut your carrots into sticks and make a snowman out of it, shape them into toys. You can make something like apple, cut it like a star. Oh, first of all, they'll become intrigued by the shape. Oh, tell them you can actually eat it. They're like, right? There's so many ways. Or you can blend it and put it into whichever food they love to eat. We start with that.
Yeah.
Yeah, and then gradually they will get to accept it and then continue to feed
Just
them.
before you go ahead, Dr. Dolly, you have just said something that actually activated something in me.
Okay.
Right? Yeah, you were talking about parents actually cutting the vegetables in different styles,
and
shapes, and
shapes, and
fashion.
that's right.
And we have this salad master machine,
Oh
yeah,
yeah.
with 5 different cones. Now,
Yes.
I mean, those of you who probably haven't seen that machine, you probably want to see one of our presentations. It's an amazing piece,
That's right.
and it cuts so many shapes and sizes.
I've
There
seen
was this
it.
day I was on a presentation with a family, and I
Mhm.
did the carrots. My
Oh my
goodness,
God.
the kids loved it because it looked just like snack.
You see.
Right. So that machine, we had it here 2 shows away. I
Yeah.
mean, 2 shows, previous shows, and
Yes.
we'll have it the next show so that you can see that machine.
Yes.
Right.
Yes. So that makes life easier for mothers. You don't have to get out your carving pencil and stuff to do that. You just have to get a salad master machine, and then up you go. Great, any shape you want, any size you want, any fruits actually cannot actually undergo those kind of shapes and sizes, and then kids
Right.
will find it very attractive to eat. Now, another one is physical activity. You might be feeding your child right, but you notice that the child forever is in front of a television playing video games.
Yeah.
So what you need to do is you come in and tell them stop playing video games. Fine, and he stops. He now moves into watching movies. So that's the challenge of kids of this era.
Wow.
But yeah, so now it's up to parents again to make sure that the physical activities are timed and they are limited. You don't leave them at home and said. And then there's another trend that I also noticed that parents do. Maybe for people who live in a block of flats, they don't want kids downstairs. And they don't want them playing with the neighbors' children. And what do they now do? When they are going out, they lock the kids inside, put on the television for them, and then they watch television. They can be there for the next, they are watching TV programs.
Wow.
That way, there's no program on the television that they don't know.
Mm.
But then it might be good in some way because it keeps them out of trouble when you're not there. But invariably, for their health, it is not good. So, what we need to do is find helpers who will help them. At least they can watch television for 2 hours, then go downstairs under the watchful eyes of a guardians and then play because kids need to play.
Yeah, kids need to play. And Dr. Dolly, you see, there are some kids who probably don't watch lots of TVs as they
Okay.
eat, right? They probably read their books, yeah,
Yes,
and
yes,
they eat as well,
that's right.
right? So is it also advisable? Because I mean, kids who are studious with their
Yes,
books,
yes,
but they always because they are always on their books, then they are
yeah.
eating every minute, every second. So how would they manage it? Because what you're doing is right in terms of
Hmm.
reading. So
That's
how
right.
would they be able to create a perfect blend, you know, to have the perfect health and body?
Okay, fine. I see that happen often. Kids will be reading, and moms will just come behind and with a hot plate of steaming rice, okay, and they'll eat and continue and all of that. Well, for me, I come from a family of doctors. So my dad, what he did was before you read, even though you can't go outside, you can get a ball by yourself in the room. He will encourage you to play. Slam the ball on the wall. Keep doing that until you sweat. Go bathe and then come and read.
Oh, that's
And
good.
after 2 hours, he comes again. Yes, if you forget, he comes. He makes sure you're healthy because he says it that 85% of your examination depends on your health.
Mm.
Yes, that if you're not healthy on the exam day, no matter what you have in your brain, you're not going to write it.
Wow.
Yes.
Wow.
So the thing is, be healthy. Once you and that thing took me through med school. Whatever I'm doing, I still have time to exercise. And once I appear at the examination hall that morning healthy, I take it that 75% of my exam has been passed.
Wow. Wow. Beautiful.
Yes,
Beautiful.
yes.
Fantastic.
That's it. So
Fantastic.
as a parent, you make sure that they eat well and they exercise. And most of the time, if you walk in your on your child reading, please don't give them any heavy food. Snacks can do.
Okay.
A cup of tea, that's good. Is even a stimulant. It stimulates the brain more. Cup of coffee, that's okay. You can bring cashew nuts, almond nuts, all of that. And it's not when a child is reading, bring a bowl of ice cream. They are eating and no.
Yeah, yeah. We find out a lot in today's world.
Yes.
You know, they call it pampering, isn't it?
Yes.
Yeah. Well, and people even use it as what do I call it? When a child does something for you and
Yes.
you want to give them a gift or something in the
Yes.
house,
Yes.
then you say, "Do this, Junior. I'll give you ice cream.
Oh my
You
God.
know, do this. I'll give you burger, or I'll give you this." And
Yes.
they actually go out of their way to buy those things for the children. Now
Yes.
you're saying that that's not the right way to go.
No, that's not the right way. But for kids, there's no harm in having ice cream, but it has to be regulated.
Yeah.
If you see, ice cream is supposed to be treats, once in a while treats, not everyday thing. Some people go as far as buying buckets of ice cream and loading it in the fridge. Once the child comes home from school, he just drops the bag and runs to the fridge and get no. And by the time they scoop, like have like 2 or 3 bowls, they don't want to eat because where will the food stay? They've already had their fill with ice cream.
Mm.
So now it should be that ice creams are usually meant to be desserts. So they must have eaten their food. And on the days in which they will have dessert ice creams, they should have it in controlled portion.
Mm.
Yes,
Okay.
that's the way it is. So those are the things in our environment that can cause the kids to be obese. I believe that if these things are checked, we will have fitter children
Right.
in the society.
Right.
Next, we're going into is diagnosis. Diagnosis in this case is usually self-diagnosed. If your child is obese, you know. You don't need anybody to tell you.
Okay. So that's in the size, you mean?
Yes, in the size, of course.
Okay.
They just get larger than their age mates,
Mm.
abnormally larger. That shouldn't happen.
Okay,
And then,
just to ask, Dr. Dolly, what's the difference between, yeah, you find some children, some parents say my child is not obese, they are just overweight.
yeah,
Is there those are two words that people use interchangeably sometimes, but
that's
what's the major difference between someone who is overweight
yeah.
and someone who is obese? Is there a major difference?
Yes, there's a major difference. The difference is basically the BMI. Once overweight and obese is just 5. For the adults, once you're 25, your BMI is 25 or more, you're obese. Once your BMI is 30 or more, no, once your BMI is 25 or more, you're overweight. But once it's equal to 30 or more, you are obese.
Okay.
So overweight is 5 steps away from being obese.
So I can rightly say that if you're overweight, you're
Yeah.
on the track to being obese.
That's
You're on
right.
the way. to
If
being
not
obese.
checked, you're
Yeah.
ending up as an obese
Oh,
patient,
I
class
see.
1
I
obesity.
see. I
Yeah.
see. I have some message for some people who are watching right now. Yeah,
Mhm.
I have some people who are watching right now, and they usually say they're overweight. Yeah, so you just heard from Dr. Dolly. You're on the way.
On
to
the
being
way.
obese.
If you're not obese
Okay,
right
so
now,
check it now.
you're going to be very
Right.
soon if you
Okay.
continue with whatever it is that is making you be that way.
Right. Right.
So
Okay.
the next one is diagnosis. Apart from being self-diagnosed, you can use the growth chart for children. Weigh them. In fact, it is encouraged that every family must have a weighing scale in their bathrooms.
Mm.
Yes, so that kids can be weighed. You will know if they are getting overweight, and then you can stop it, because usually when they get obese, it is
It's difficult to go back.
it's a problem.
Wow.
Yes, the
Wow.
problem is a real problem. Now, what are the symptoms? What do you see in a child to say, oh, this is a case of obesity? Number one is there might be no symptoms at all, but other than the weight being above normal, I don't think there's anything they manifest with. Again, another one you can see if you look well is poor self-esteem. It's always there. For
Okay.
fat children, they come up with poor self-esteem. They don't want you to look at them. They feel self-conscious,
Yes,
whatever
sure.
they're doing and all of that. And then again, on yet another closer look, you can see them depressed
Okay.
because of the way the other kids taunt them at school because of their size.
And if it's not checked, it becomes a psychological thing,
Yes,
which develops to become something else.
invariably, any child who's diagnosed obese after losing the weight has to undergo therapy.
Wow.
Yes,
Wow.
it is that deep.
Wow.
It is
Wow.
that deep.
So the best cure is actually prevention, isn't it?
That is it.
Okay.
And that's why your $1 billion body is
It's right here.
for
Yeah.
you.
Right.
Yeah. Now, the risk factors. What are the risk factors? Diet. Like I said, regular consumption of one, baked food, ice cream, Candies have a whole lot of sugar packed in them, and we know how kids like candies, but it can also be regulated because most of the foreign movies I've seen, you see parents pack candies in a glass bowl, and they will keep it anywhere, maybe
On the dining,
on the
something,
dining,
yeah,
yes, where the child can easily access it.
yeah.
It's not meant to
Or in
be
the
that
kitchen,
way. Yes.
you know.
And apart from adding weight to the child, candies also damages the teeth. Now, another one is fruit juices. People think, okay, because there's fruits in it, it's all healthy. No, it's not. It contains lots of preservatives, lots of sugars, and all of that. So we should be careful how, instead of fruit juices, why don't you give them a whole fruit itself?
Okay.
Yes, it's
Okay.
better that way.
So, what's the how do you then know? Because we have lots of these fruit juices in shops and
Yeah,
malls these days.
yeah,
You know, some of them even are imported.
that's
You
right.
know, just to share with you, someone was showing me something they purchased before the lockdown. Lemon,
Okay.
lemon. They
Wow.
purchased from the shop before the lockdown.
Okay.
Now, just yesterday, the person showed me that lemon,
Yeah.
and the lemon was still intact.
Oh my God.
Now, how many months ago?
Oh
That's
my God.
that's
Like
way
4 months ago.
5 months ago, and the lemon is still intact. So I was asking, that means there's something definitely in that lemon.
Definitely.
So you are saying that
Definitely.
in these juices, the canned juices and all of this,
They are all impregnated
right?
with
Right.
those fattening agents, with preservatives and with sugars and all of that.
Wow.
So
Wow.
it is encouraged. Get locally, any fruits that is locally accessible is
Wow.
the best.
Wow.
All these imported fruits, of course.
Or you could make your juices.
Oh, you
Yeah. You could
exactly.
juice your watermelon.
At
Your
home,
yeah.
you can make a smoothie out of it.
Absolutely. Absolutely.
So that all that is so much better. There's no way you leave something that's not natural. Leave something for 5 months and it doesn't decay. There's
Something
something
definitely
is at play
is
here.
in there. Okay.
Exactly.
Right.
So who knows if it keeps, and that cancer it as abnormal cells that are just in the body growing. So all those agents can be a source of cancer if consumed.
Wow.
So you just use your money and you're buying
Wow.
problem for yourself.
Wow.
Another one is lack of exercises. Like I said before, too much time spent in playing video games, watching TVs, reading, like we said, can cause obesity in these kids if not checked. It should be regulated and monitored by adults. Now, family factors. If a whole family happens to be obese, definitely the kids coming from that family will be obese.
Okay. So that's hereditary kind of.
No, it's not hereditary. It is family pattern.
Okay.
How family eats.
Oh, so they're eating pattern. Yeah.
Yes, they're eating patterns.
Okay.
If your parents favor fast food,
Oh,
that's what you
wow.
know.
Wow. Dr. Dolly, someone might be watching the show right now and is thinking, what's the accurate alternative? Because these days it's almost impossible to get the kids away from video games, and even kids now have Netflix accounts
Oh
for
my God.
their dad's Netflix account, and they're oh sorry, I mean I withdraw that. Yeah, I
Okay.
withdraw that. They have several
Subscriptions.
subscriptions. Yeah,
Yeah.
and they're watching these shows. What's
Yes.
the right alternative for these children in terms of playing, and how can they get along?
Okay, fine. The only thing is about balance. All the playing of video games and watching TVs and all of that, they're actually not bad in itself, but it is how you use it that can turn it into bad or good. Now, the first thing I encourage parents to do or guardians to do is first of all, draw a timetable of their activities. Give video games and watching of televisions 1 hour each. When they are done, can go outside and play soccer. They can go outside and go to the fresh air. Include activity, inspired games
Like
into
games,
your
family
life.
games.
Yes,
Okay.
you can. There's nothing stopping the family from going to a picnic and then having the kids play
Yeah.
while their parents are around to watch them play.
Yeah, I've
Okay.
seen Mr. Tony so many times. Yeah,
Okay.
he's probably watching right now. I've seen
Okay.
him so many times with the family in the UK, and they're playing soccer. You know,
Exactly.
they're almost all athletes in the family.
That's it.
The son the other day was doing push-ups, about 44 push-ups.
Yeah.
So
Because he saw daddy do it.
absolutely, absolutely.
That is
And
it.
for him, I know he's been on the program for long and called Insanity. You know, it's a program that keeps you fit.
You
So
see,
things like that is what you're advising.
that's it.
Okay.
Incorporate exercise, incorporate houses that have gym in it. Encourage the kids to use the facilities.
Wow, great.
Yes, they
Great.
should. They
Okay.
should.
Okay.
Then again, kids can have something like bikes. You know,
Yeah,
that's an activity kids enjoy.
that's a
it
good
too.
alternative.
That's a
really.
good alternative because they are active. They are doing it. They are involved. Not just develop the brain only, and then the whole body is dragging
That's right.
along.
Okay. Fine.
So that's it. Now, there's another risk factor which is called the psychological factors. Here you have it can be personal, family, or then parental factors. Here, what I mean is that if the family has stress in it, the mom and dad are always bickering at each other or always at each other's throat. Again, the parents might be undergoing divorce. Now, some kids or children, they tend to overeat to cope with problems. Yes. So when parents are busy fighting, they are just in the kitchen. Anything they can get their hands on, they are eating. Not because they want to eat, but because they are forced to, because of the stressful environment they find themselves in. So that can be their own coping mechanism.
Wow.
So it happens. So now when you're complaining, I'm not the one feeding my child. He's always eating. So why? Something is driving him to food. Yes.
Okay.
There's something lacking. So now that is what parents should need to look at. Do I quarrel in front of the kids? Do I raise my voice in front of the kids? See, there are some parents who don't. They have their issues settled in the bedroom. There's a reason for that. Yes, because you don't want to put the kids onto undue pressure.
Right.
Yeah, they're kids. They don't know how to cope with things. So most of them overeat
Sure.
because they have issues at home.
Yeah. And I mean, sometimes we feel that they're kids, so they
Yeah,
probably
they
don't know
don't
what's going on.
understand.
Right.
They do
They
understand.
do understand.
They do.
Yeah. Especially these days.
Ah,
Yeah. They do understand.
kids are smart.
Yeah. Right.
So they know and they understand. So parents should please handle their problems and don't make their problems their kids' problems.
Right.
Yes. Now that brings us to complications of obesity. Again. Now, the other one I did it system by system, cardiovascular system, neurological system. Now let's break it down. Obese children usually come from obese parents. Yes, usually.
Wow.
If you see 10 obese kids, 8 out of those kids, their parents are equally obese. So it's a family thing. The mother should tell herself the truth. What's your portion control like? Or a child should be controlled because at that age, they are still impressionable. When you give them the first serving of food, I think measure what is good for them and leave it at that. When they come again, mommy, I want more, give them fruits.
That's when they take the fruits.
Yes,
Yeah.
give them fruits. Mommy, give them salad. Give them something healthy. Or tell them later, you can have it in 2 hours' time. They don't have to finish everything in one sitting. No, parents should just do that because usually obesity starts from home.
Starts from home.
Yes,
Wow.
starts from home.
Wow. Obesity starts from home.
Yes.
Wow.
So now, as I said before, complications of obesity, you have cardiovascular system. Let me just break it down. High blood pressure. I've seen a 15-year-old with a very high, very severe high blood pressure.
15-year-old?
Yes, 15. And we couldn't even pass the cuff around because he was too big.
Wow.
Yes.
Wow. Wow.
He was too big.
That is 15-year-old.
Yes, 15.
Wow.
And then I've seen another 31-year-old came as an emergency. He just couldn't breathe. He was big. The sister told me, I was like, what else? He said he was so big and he doesn't go to work at 31 and he smokes.
Wow.
So he already has his own special doctor that takes care of his high blood pressure. He's like, the doctor traveled and then he happened to come to my clinic. So that's how I got to know him. So I started first of all by telling him, after we bring down your blood pressure, you need to work on your weight. That was the last I saw him. He didn't come.
Wow. He didn't come back.
He didn't come back.
Amazing.
He didn't come back.
Wow.
Yeah.
So it looks as though, I mean, people who are obese often, eating is like an addiction.
Yes.
From what you say.
Yes.
Because if someone is giving me advice to cut down, on how to cut down, I should regularly go to that person, isn't it?
Yeah.
But they disappear. They don't return.
They don't return.
That means it's like an addiction.
It's it's not like it is
an
an
addiction.
Yeah,
Wow.
it is.
Yeah.
And they don't want to tackle it, don't want to face it. They
Wow.
don't want anything happening.
So maybe before the show ends, you'll give us some ways to actually curb this addiction. Maybe a healthy substitute like you're sharing now.
Yeah, if they happen to come around and don't run away.
Right.
Okay.
Right.
So another one is diabetes type 2, invariably. And this type 2 comes earlier than normal.
Sorry, is that in kids?
In kids.
Wow.
Yes, in kids.
Wow.
That's what I mean. Diabetes type 2, you see kids, 18 years, they've started manifesting with diabetes.
Wow.
You're asking, what's going on here?
Wow.
And you will ask the parent, they tell you they were not born with it.
So it actually has come from lifestyle.
It came from lifestyle and what they were
eating.
Yeah, that's what they're eating.
Wow.
Another one is asthma. Yeah. Kids who are obese invariably have asthma. Like I said, they are overworking the lungs. They are overworking it. So, and then constricting all the windpipes and everything. By the time they are obese for like 3 years, stuff like asthma starts showing up.
Wow.
Again, have you seen any obese person sleep? Is a problem. And they usually have, like I said yesterday, for the adults as well, they have obstructive sleep apnea. Apnea means cessation of breath completely. Some of them, you watch them sleep and then they wake up with a jerk. Like someone was trying to suffocate them. No. It can actually be that the fat was actually the one trying to suffocate them.
Wow.
So we should please don't put our children on this. It is heartbreaking to watch. Yes, heartbreaking to watch them sleep. It's never a restful sleep. It's never restful. Another one is their livers are affected. We have what we call non-alcoholic liver disease. When you look at the slides, take a sample, maybe biopsy of the liver tissue, and then take it to the lab. You'll be amazed at what you see. So much fat packed in there. Usually, what causes this is excessive alcohol intake in an adult, but in children, fat can give you the same picture.
Can give that same
yes,
picture. Wow.
Can give you the same picture. And like I said before, bone fracture. It's not a joke. Most of them are on clutches. I've seen them.
Wow.
Yes.
From being obese.
Yes.
To
breaking a limb. Oh my God. It's like this. They break limbs like crazy.
Wow.
They can do jumps with other kids and they won't come out of it.
Wow,
yes.
That's amazing.
It definitely breaks something. So if you're a parent, I don't know any parents who still feel joy at watching your kids undergo this pain. I don't know whatever satisfaction you're getting from people and compliments you're getting from people. Oh, your baby's so well fed. Your baby's so good. Your baby's so big. Oh, small boy of yesterday. All those compliments, and then the baby is always in bandages and clutches.
Correct me if I'm wrong, Dr. Dolly. Yeah. I think parents often feel shy when their kids are so skinny, especially in public, like you just mentioned.
That's right.
So they want to feed these children fat.
Yes.
And you said something a while ago. You said not to feed fat.
Feed them feet.
Feed them feet.
Don't feed them
Don't
fat.
feed them fat.
Yes.
Feed them feet. Wow, that's a good tagline.
Yes,
feed them feet. Wow.
So now, what we are advocating in this program, we're not advocating for kids to be skinny either. But a fit child is a fit child. I mean, you're not skinny, you're not even fat. Yeah, the baby is okay. That's what we advocate. As mothers, make sure they are eating properly and healthily. Once that is achieved, then the rest is not your problem.
Okay, what about someone who says, I don't eat a lot, I don't eat a lot of food.
Okay.
Yeah, but yet I'm growing big and I can't seem to manage my weight. What would you say the challenges in that situation?
Wow. I get that a
seen
lot.
that? Yeah, okay,
yes,
right.
I get that a lot. They said, doctor, I don't eat though.
Yeah.
I don't eat though. And I'm this fat. If I eat now, how will I be? I say, really? You don't eat? Fine. Let me give this example. See, for the people, some of my patients who claim that fatness runs in their family, yes, genetics plays a role, but it is more in the distribution of the fat and how you metabolize your fat. Genetics really doesn't put fatness on you. No. Now, one thing I would like to point out is that, have you ever watched any movie any war movie,
Mm.
real war,
Mm.
there's no fat person
Mm.
in those videos.
Mm.
What's the problem between them and us? They don't get to see food during wars.
Oh.
And during wars, those people who have family and who inherit fatness, they are still there, but they are not fat. So what happened?
Mm.
They're not getting food. So what I'm trying to say, in other words, is that it is baggage in, baggage out.
Okay.
It's what you get in that's what comes out. I once went to a wedding, and the MC was so funny. It was so hilarious. He was introducing some people, so he now said, look at these people, look at their body, in fact, it is what goes into the mouth that is manifesting in the
Absolutely.
body.
You are what you eat.
That is it.
Yeah. On our presentation, we have that.
Yes, you are exactly
what you eat. Yeah.
If you are fat, please check. There are some things we unconsciously do, and we don't tag it as eating, but those are eating.
Okay, like things like what?
Like snacking.
Okay.
Like you can be in a hold up and you're just so bored. You flag down a hawker who's selling all these maybe like buns, fish roll, gala, and
that's very consistent in Lagos.
of course, because
when...
that's environmental stuff. Everybody has been I do that too, but I consciously go out for nuts.
Right.
Yes, okay. I consciously go for nuts.
Yeah,
because when you're in a hold up, it's irritating really. Mm. And then what can you really do to keep your mind up? So you need to be nibbling on stuff.
I've seen some cashew nuts,
Yes, they do cashew nuts.
And all of that.
They even do fruits. If you can get water to wash it, please do. And don't be doing, because in that place you don't know how long you're going to take. Yeah. So you can keep consuming and combine it with sugary drinks, all these sodas that they sell. So it's a disaster, really.
And someone who works a day job from Monday to Friday probably would
experience that exactly
every day.
And then when you get home, because that is not food, according to you and your brain, you still get home, you do dinner. When you do that 5 times a week for 4 weeks in a month, by the time you get to your scale, it will tell you, even though you thought you were not eating, you really were eating. Yes, so it's going to reflect. Okay. So those are the things you need to check. What is happening? Am I a stress eater? Some people might be stressed at work and they keep eating. They keep eating. They keep eating. They keep eating. So you need to watch those environments and those situations that put you in that type of way, and then consciously work against it. Or you can there are so many things you can do. If you're in an office and you know that you're always eating, you can buy stacks of dark chocolate. Okay. Dark chocolates are healthy, very good for the heart. And you're eating something. The brain just wants to know that you're eating something. Okay. That's it.
Right.
There are so many healthy substitutes. If you look for it, you'll see it.
Find it.
Yes. Okay. And then another one again is social withdrawal. Like I said, there's so many psychological effects of obesity on kids. Social withdrawal. You see them, there'll be so much taunting in school that at one point say, I don't want to go to school. I don't want to go. It's because of how they are. Some of them will go as far as telling you, I hate myself. Wow. I do hate myself. Others want to die. I just want to kill myself. Nobody wants to be my friend in school.
Wow. And for kids who are growing up, that is not a good place to be. That's because it affects them as they develop, isn't it? Yeah. So parents right now listening, I think Dr. Dolly is actually hitting the nail on the head. And we just have to imbibe these healthy substitutes.
Yes. Yeah. That's it. Right. So now we've gone to the complications and details. We've come out from the cardiovascular system to break it down and tell you they are liable to get hypertension. They are liable to get diabetes type 2 at very tender age. You can imagine. And with this kind of patients, by the time they get to 40, they're already on insulin, and they will be on that till they die. Wow. That is, God didn't create them that way.
That's not a good thing.
It's a bad thing.
Yeah, that's not a good thing.
And when most of them, when they get older and realize that they've been put in harm's way by their parents, they don't find it funny.
Wow.
They don't find it funny.
Wow.
So we as parents or as guardians should encourage kids and take them to the way, that's long and narrow path that is difficult to work on initially, but at the end of the day, the benefit is immense.
Benefit is immense.
Yes.
So it's just to start from home, really. Yeah.
It starts from home.
And the best time to start is now, just in case you haven't started already. The best time to start is now.
Even if you can be discouraged, you already have obese children and you're like, how am I going to start? Start something. Start with something. Nothing is too little. Just start.
Wow.
Start as at this time that you came across this, starts. It's not going to be easy, I assure you. They're not going to find the change in diet funny, but keep at it.
Wow.
Yes, keep at it.
Absolutely. Just before you continue on the treatment, Dr. Dolly, let me just say that for the viewers watching today, if you have questions, please put the questions in and we'll take all your questions today. Okay. Dr. Dolly, over to you.
Okay, so now the treatments. Treatment here is the main people that we're directing this treatment is to the mommies in the house, the dads, the aunties, the child caregivers, and even the school teachers. You watch and then let the parents, a particular child all the time carries a particular kind of food to the school. Maybe the parents don't know, or maybe they don't have time to prepare healthier meals for the kids. You need to call their attention. Madam, this child is always coming to school with rice all the time. Rice only, all the time. Rice. Is there nothing else you could do? How about adding salad to it? Reducing the quantity of rice and then add salad to it. Or how about giving some fruit cuts in it? Teachers also have a role to play. And then if schools can afford it, they should also provide snacks, healthy.
Even schools.
Yes, schools, because kids spend most of their time there.
In schools.
Yes, in schools. So they should. If parents are not doing it right, teachers have a role to gently correct.
Okay.
Yes, gently correct. And kids, once they see that, oh, my friend is having fruit, there's tendency to want to have it.
They want to get it too.
Yes.
Yeah.
But if at home, the teacher and mommy reverses everything, and then I implore mothers to please be humble enough to take the correction that the teachers are passing across, because they see these kids, they see how withdrawn they are at school, they start looking. And if you have such teachers that can make such observations and bring it to your notice, I think it's a fantastic thing.
Okay.
Now the treatment continues like this. Give foods that are low in, number one, carbohydrates. Kids need it. Kids need carbohydrate. Make no mistakes about it. But please, don't overdo it. At least 60% of the kids' food should be made up of carbohydrates. But for an adult, 40% is okay. 60%. But 60% shouldn't be 100%. Then the food should be low in fat as well. I'm not saying eliminate fat completely, but low in it. Another one is portion control. Portion control. I've come across some people who I was shocked. Went to their house. I saw 3 bowls of of rice, in front of a particular boy of 15.
Wow.
So I was thinking other members are still coming. It's like he ate last. He just came home.
Yeah.
And he finished the first bowl, dragged it away, and dragged the second one.
Amazing.
Finished it, so I'm then dragged. I said, no, I can't keep quiet. I can't keep quiet. I said, that's how he used to eat. I said, really? And who used to give him?
Wow.
Mommy. No, he doesn't have to eat like that.
Wow.
The boy he didn't look at me in a funny way, but I know that it needed to be said. It needed to be said. Another one is limiting screen time for kids. Computer time, game time, television time should be limited. Then parents should enforce physical exercises, like we've been saying. And then if they're really obese, please enroll them on weight loss programs and see that they do it. Another one is, like I've said, limit the kids' consumption of sugary drinks and beverages. These ones are also a very silent way, because the kids might just be having normal food portions, but they binge on sugary drinks and soda. So it should be looked out for. Gradually limit it and then automatically stop altogether. Now, provide plenty fruits and vegetables. Like we've been saying from the beginning of this program, this is a lifestyle problem and it should be treated as such. So the best way to treat it is to change the lifestyle you currently have. Because obviously, if your child happens to be obese, there's something wrong with the way you're feeding them. Another one is eat meal as a family as often as possible, because you, the parents or mom and dad, can be like civilized and health conscious when it comes to feeding. But when you're not home, kids go into the fridge. You will tell them your food is the microwave this and eat. They will leave it for you then go for what they want. Yes, it's possible.
Yeah.
So it's encouraged. If you are having a family meal together as often as you can, you'll be able to really check what goes into their mouth.
That's true.
Yeah.
You see, growing up, Dr. Dolly, I
Yeah.
mean, we used to eat as a family,
Yeah.
you know, and
Yeah.
the portion was controlled,
You see.
you know, and I don't know, but I felt that food felt sweeter. Yeah, I don't know, it felt sweeter because you
Yes.
have everybody there eating, you know, and
Yes.
it also creates room for bonding, family
Yes.
bonding, you
It
know, and the
bonds and
parents are
there's this
there, right,
closeness. And then when you take too much, they will question that is too much.
right,
That's like for us, we might not do every meal together, but breakfast is always together. So now for me, I remember growing up, I liked milk a lot. So when you take first spoon, you look around, who's watching? You take again, look around, who's watching? Take again. My dad would say, hey,
yeah,
stop it. So because he was able to curb it because he was present.
absolutely,
Yes, but if he wasn't present, I do what I want.
right,
Yeah.
right,
So kids are kids, they should be guided. Another one is limit taking them out to fast food joints.
Mm.
It should be
That
limited.
is one I think we should
Yes.
throw some light on,
Yeah.
because I mean, I don't know if it's a trend these days. Not many people actually uh, do home cooking. That's
Yes.
why what Salad Master is doing now is to lead the movement back to healthy home cooking.
Yes.
You know,
Turning your kitchen into your clinic.
right? Absolutely. And
Yes.
those meals become healthy. You know, and you could eat all of this. For instance, we can eat so we can eat some things that are baked,
That
but
is
in a
it.
healthier way,
That's
you
right.
know, and you don't have to eat in larger proportions because the nutrition is actually
It's
in the
there.
food. So before you are done eating, you're almost full.
Yes. And another thing is time. Cooking wastes a lot of time. And most women these days are career women.
Yeah.
So by the time they're done with work and their father is also back and he's tired. So the best thing is either they do deliver the food at home or you go and eat it.
Wow.
So that's it. Maybe you're so tired. So on your way from work, you just pick a box of pizza
For
and
the
the family.
for the family.
Yes, for the family.
Right.
And that is it. And that's how we start. So maybe the next day when you ask them what you want for dinner, pizza, and it starts.
True.
And before you know it, they're all getting out of sizes. So we should really please limit the time we take them out to fast food joints. Another one is also teach the kids how to make healthier food choices. Teach them. Instead of milk chocolates, introduce dark chocolates to them. Instead of ice creams, there's nice creams. You can make your fruit into ice cream. They're healthier food choices. Instead of having butter, margarine, and all of that as spread on the bread, you can do avocado spread. It is still yummy and then all the more healthier for the
Wow.
kids. Yes, there's so many things you can swap. So many things you can swap in places of all of that to make your kids come up as healthy as you need them to be. Another one is adjust their portion sizes. There is a particular portion of food that is appropriate for ages. Check it. If your kids are 7, 8, and 9, you dish food for them appropriately. You don't take a food that is meant for a 30-year-old man and give a nine-year-old boy just because you love him
Yeah.
or and you want to spoil him and you want to pamper. You're killing the person.
Right.
I know that there's no parent who will, no matter the amount of money you have, will go and buy a Ferrari for a 10-year-old.
Of course not.
Oh,
Of course not.
so it's equal. If you can't do that, then don't do this.
Yeah.
Mhm.
Wow.
That's just the way it is. Now, as we said earlier, another one is ensure that your child gets adequate sleep. They take a nap during the day. Because if they don't, that time they use the napkin, they're in the kitchen. They're looking around in the fridge. And if it's possible, mothers, please get keys to your fridge.
Wow, I
Yes.
know. That's one that I want to just stress a bit. Are you
Okay.
saying they should have keys
Yes.
to the refrigerators
Yes. If
and
it's
lock it?
possible, lock the
Oh
fridge.
wow,
Yes.
yeah,
I know some families who lock the entire kitchen.
wow,
Yes.
wow. But you probably want to make readily available some substitutes, healthy substitutes for the kids
Yes.
that are, I mean, in places where they can reach it, so that
Yes.
the kids don't start saying you've locked the whole house and they can't
And
find food.
there's hunger strike in the house. No, of course not.
Yeah,
If you lock the kitchen, you put fruits in the dining.
absolutely. Okay,
Mm.
right.
So they, if they come around, they will eat it. So with that, we're employing parents, 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 parents. This is your take. Any child who comes out obese, the first thing is to look at the mother. So we're employing for our kids to be fed fit and not fat.
Not fat. Yeah.
Yes,
When you say look at the mother, I, I mean, a mother is watching right now,
that's right.
and he said, "Why should they have to look at me? Why do I have to be the one to blame?
Oh, yeah.
So why would you say look at the mother or not the father?"
Oh, first of all, the first look is at the mom. Oh, are you the one that is feeding this baby like this? In as much as we have some men who are domesticated and all that, but most of the time, the kitchen is more of a woman's business. Yeah, that's it. But then it doesn't mean that the father should look away entirely. But for me, I just told the story how when I was even doing the milk thing, my mom was there. I don't know, it didn't come to her to tell me, but it was my dad. That's too much, young lady. Stop it. Do this, do this. And even when we were studying, he was the one that comes to check. Have you exercised?
Mm,
Stop it. You've been reading for 2 hours. I need you to go outside. Go with your football.
mm,
Nothing prevents the daddies from doing that.
yeah,
But for me, when a couple comes to the hospital with a obese child, I look at the mother.
yeah, yeah. I think both parents actually, like you rightly said, both
Yeah,
parents have a role to play. Because
they do.
most times, Dr. Dolly, you have these kids sending messages to their dads at the office. On your way home, buy me this, buy me
Yeah,
that. So I think the dad as well, has a role to play, as
yeah,
well as the mom.
yeah,
So
exactly.
both parents,
Both
really, both
parents,
parents.
both of them.
Yeah.
And the thing is, if your child tests you, buy me this, run it through mom. Should I buy this? Have
Okay.
they had their share of ice cream this week? Should has correspond together. If they said, okay, no, the last time they had ice cream was last Saturday, you can get them.
Mm,
Yes.
okay.
So those kind of foods, they are not to be totally eliminated, but they should be taken as treats once in a while.
Okay.
Yes, once in a while. So with that, we come to the end of this um, program, and we're
Wow.
looking forward to the questions.
Wow, 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 wow.
Yeah.
Thank you very much, Dr. Dolly. I must say, thank you again, everyone who is watching.
Okay.
Just want to confirm if we have questions, but there's one I want to ask Dr. Dolly as they actually check if we've got questions. I believe you've had a wonderful time today. It's been amazing learning. And Dr. Dolly, before I ask that question,
Yeah.
most of the things you mentioned today are actually food, diet, portions, portion control, and all
Yes.
of that.
Yes.
And you know what? We have this wonderful program brought to us by Salad Master.
Okay.
Yeah. Now, for those of us who don't know about Salad Master is that healthy cookware cooking company that actually ensures that your food retains a maximum 93% nutrition in your food.
Wow.
And what Dr. Dolly is saying is you can take your rice, you can take your vegetables and cook them. And when you're eating, because of the right nutrients you're getting from the food, you don't have to eat so much
That's right.
before you get full. And sometimes when you eat that food, it can take you longer time before you start to feel hungry again.
Hungry
Yeah.
again.
So I just want to say thank you to Salad Master because I personally have had some parents who had children struggling with, I mean, they were overweight, just on their
Okay.
way to being obese. And
Okay.
they actually saw a Salad Master presentation and they got a Salad Master set for
Wow.
themselves. Now, if you go into those homes now, you know, they are so excited.
You
And
see.
there's something about the children, they become brighter.
That is
and
it.
sharper, you
Yes.
know. So I just want to say thank you to Salad Master for bringing us this amazing program.
Amazing program.
Amazing program. Yep.
Yes.
The question that someone has asked Dr. Dolly is, can obesity lead to cancer? What's the connection between obesity and is there a connection between obesity and cancer?
Definitely.
Yeah. Maybe you
Definitely.
just want to shed some light on that.
Yes, I did. Yesterday we talked about it at length, but for the benefit of the person asking these questions, I'll go back again.
Yeah.
Now, certain cancers are very, very, very prevalent or connected with obesity for over time. Now, obesity may increase your chances of getting, first of all, if you're a woman, uterine cancer, cervical cancer, and endometrial cancer. All these cancers are on and around the uterus of a lady. Another one is for women too. They are predisposed to having ovarian cancer. All these are complications of obesity. I mentioned it yesterday. I didn't bring it up in the children because not yet. Even if it has to happen in the children, it's later on in life. Another one is breast cancer. Yes, women who usually come down with breast cancer. I'm not saying that slim women don't have breast cancer, but it has been proven over time that one of the complications of obesity is breast cancer. Another one is also colon cancer. Like the example I gave yesterday, colon cancer is real. The actor who acted Black Panther, that's Wakanda, is dead because of colon cancer. So it is real.
That's sad.
Yeah,
That's
really
sad.
sad. So another cancer that is also linked to obesity is esophageal cancer. I can imagine why. I can imagine why because this is the esophagus going to this is it going to the stomach. So now when you're always eating, some this place is getting worn out all the time, and then cancer is all about metaplasia. Once a cell is supposed to be round, but because there's so much pressure, it starts bending like this. At one point, it gets distorted entirely, and that cell can be termed cancerous. Yes.
Okay.
Another one is for men, gallbladder cancer. Obese men are usually complicated with gallbladder cancer. Another one for men also is prostate cancer. We've talked about prostate cancer in this on this program before, and when we dealt with it, we also mentioned that obesity is one of the things that can cause it. Now, another one is liver cancer. Because the liver, this is the liver. The liver is such an organ that is the only place that is not the only place though in the body, but fats can also be stored there. So when it is overwhelmed with fat storage, it can just become cancerous. So really,
Okay.
there are a whole gamut of cancers that can
Wow,
be
wow, wow.
identified with
So you have
obesity.
seen it today, and thank you, Dr. Dolly. Thank you, everyone, for coming on this show. Your Billion Dollar Body Show will come to you again, and you'll get all the notifications. Thank you for joining us today. It's been a fantastic time. Thank you, Dr. Dolly. Yeah,
Okay.
until we come your way again next week, have a fantastic evening and good night. Bye bye.
Good night.